name is Hannah Grice. I'm going to be your nurse today. Can I get your name and date of birth?
Hayden Whittington, 12/15/03.
Okay, perfect. Can you tell me where you're at?
I'm at the doctor's office.
Okay, and can you tell me around about what time it is today?
It's in the evening.
And can you tell me the date today?
November 11th, 2021.
Okay, and what brings you in today, Miss Hayden?
Just a wellness check.
Okay, whenever you were out there, they got your vital signs, your pulse, your temperature, your respirations, blood pressure, and O2 sat?
Yes.
Okay, all those were within normal limits. And are you having any pain today?
No.
Okay, on a scale of 0 to 10, 0 being the least, 10 being the worst you've ever felt, what would you rate your pain?
0.
Okay, and do you need to use the restroom before we start?
No.
No, okay. And whenever you're walking in, I was assessing your gait, mobility, and posture, and all that looked great. Are you having any trouble walking at home or anything?
No.
Okay, perfect. So I'm going to be doing a head-to-toe assessment today. I'm going to be starting at your head, moving down to your toes, just listening to your heart, your lungs, looking at your arms, legs, all your kind of pulses. And the main thing, I'm going to be looking at your skin all throughout the assessment, making sure you don't have any lesions, bumps, lumps, moles, anything like that, any kind of scars, any discoloration or anything like that, okay? So the first thing, do you have any questions for me before we start?
No.
Okay, perfect. So the first thing I'm going to do, I'm going to shine this light into your eyes, okay? It's going to be a little bit bright, but I need you to look over my shoulder whenever I shine the light, okay? Okay, now I'm going to get you to follow the end of my pen with your eyes, only using your eyes, not your head, okay? Up, down, together. Okay, perfect. The next thing I'm going to do with my pen light, I'm going to look in your ears, nose, and throat, okay? Can get you to look up a little bit for me and open your mouth, say ah. Okay, all those are pink and moist as they should be. Next thing I'm going to do a little pinch over right here, just go check your skin turgor, and that was immediate, so that's good. So the next thing I'm going to do, I'm going to look at your lymph nodes. If you feel any discomfort or tenderness or pain, let me know, okay? Everything's still feeling okay down here?
Mm-hmm.
Okay, perfect. I'm going to get you to relax your arms. I'm just going to be checking your skin temperature from your shoulders all the way down to your wrist to make sure it's all feeling the same temperature all the way down, okay? Okay, next thing I'm going to do, I'm going to check your capillary refill. Got to be less than 3 seconds, and it looks immediate, so that's great, okay? Next, I'm going to check your radial pulses, make sure they're even and bounding strongly. Okay, they are perfect. I'm going to cross my hands. I'm going to check your grip strength, so I'm going to get you to squeeze my hands. Okay, I'm going to get you to pull against me and then push towards me. Okay, perfect. So the next thing I'm going to be doing, I'm going to be listening to your lung sounds. I'm going to be making sure you're not using any accessory muscles. I'm looking at your rate and rhythm. I'm looking at your respiratory expansion and your costal angle, okay? So for your costal angle, I'm going to get you to take a deep breath in and out. Okay, perfect. So next I'm going to be listening to your lungs, okay? I'm going to get you to, every time you feel my stethoscope move on you, just take a good deep breath in and out, okay? It's going to be a couple times, okay? Okay, we're going to be starting up here with your vesicular. You'll be moving side to side. Bronchovesicular. We're moving down here to vesicular, okay? I'm going to lift your breast up a little bit, okay? One more time on this side. I'm going to move into this side, still at vesicular. I'm going to lift this breast up. time on this side. Okay, perfect. Now I'm going to get you to turn around for me so I can listen to your posterior lungs. Before I do that, I'm going to be looking at your scapulas and making sure they're even. I'm going to be looking at your spine and your rib angles, okay? Can I get you to shrug your shoulders and push them back for me? You can relax. Okay, that's good. Let me check your spine. It's good and straight. I'm going to give you, we do one good deep breath for me. I'm checking your ribs. Your rib angle looked good. Now I'm going to just start listening to your lungs again. So just like the front, I'm going to be listening to the back. So every time you hear my or feel my stethoscope move, give me a good deep breath in and out. Starting back up top with your vesicular. Bronchovesicular. Moving back to vesicular. And one more time on this side. Vesicular again. And one more time. Perfect, thank you, those all sounded great. I'll get you turned back around. And the next thing I'm going to be listening to, I'm going to be listening to your heart, okay? So I'm going to feel around again on your chest with my stethoscope, but this time you don't have to take any breaths, okay? Okay, I'm going to be starting with aortic, pulmonic, second pulmonic, tricuspid, mitral, epigastric. Now I'm going to turn my stethoscope around just to hear the deeper sounds, okay? To the smaller side. Epigastric, mitral, tricuspid, second pulmonic, pulmonic, and aortic. Okay, sounds like you have a good strong heart. All right, so the next thing I'm going to do, I'm going to be assessing your abdomen. When's the last time you had a bowel movement?
Yesterday.
Okay, you're not having any trouble going, making bowel movements or going urinating?
No, ma'am.
Okay, perfect. So I'm going to get you to lay on your back. And can you show me where your belly button is? So that's your umbilicus. I'm just going to be looking at your skin, looking for any discoloration, anything like that. Be looking at symmetry, contour, and I'm going to start listening for pulsations and peristalsis. That's just whenever all that's moving down there, okay? So I'm going to be auscultating all 4 quadrants down here, okay? Okay, oh, that sounded great. We're done with the stethoscope now. Now I'm just going to be palpating your stomach. If you feel any kind of pain, discomfort, or tenderness, let me know, okay? I'm checking in all 4 quadrants again. All over. Okay, symmetry and contour again. Oh, that looks great. Okay, now I'm going to be moving down to your lower extremities. Okay, I'm just going to be doing the same thing I did on your arms, maybe a little bit more, okay? So the next thing I'm going to do, I'm going to be checking the skin temperature from up here to your ankles, okay? Making sure all of it's even and the same temp all the way down. Be assessing your skin while I'm doing this, okay? Okay, so all that was the same temp. So next I'm going to check your capillary, feeling your toes. Okay, and that was immediate. I'm going to go ahead and get you to push against me and pull towards you. Okay, perfect. Next, I'm checking your dorsalis pedis pulses, making sure they're even, just like I did with your radial pulses up there, okay? Okay, those are even and both strong. So if I couldn't find those, I would go to your posterior, your popliteal back there, and then your femoral, okay? Now let me wash my hands. And I'm going to be doing your sensations test, okay? So I'm gonna get you to close your eyes, and whenever you feel me, tell me where you're feeling me touch, okay?
My right arm. My left thigh.
Okay.
My right foot.
Okay, you can go ahead and open your eyes back up, and you can go ahead and sit up if you'd like to. Just make sure you're in a comfortable position, because we're all done with that. Do you have any questions for me?
No, ma'am.
Okay, I'm gonna go tell all that to your doctor. Everything looked good. On my end, I didn't see any kind of scars or lesions or anything like that. Everything sounded good. So I'm gonna go talk to your doctor, and if you don't have any more questions, I hope you have a great day, okay?
You too.
Wash my hands.